Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry. Hey, docs, welcome to another episode of Modern Chiropractic Mastery. This is your host, Dr. Kevin Christie, and today I am bringing Dr. David Rudnick to the show to talk about add-on services. I'm really starting to believe, after talking to a lot of chiropractors, whether it's in our mastermind or our coaching groups or just throughout the country, if you're an in-network insurance provider, or even if you're not, a way that I'm seeing chiropractors that are avoiding that commoditization trap that the healthcare industry is in, especially if you're in network with insurances like many of you are, the way they are escaping that and also providing a level of care that is great is through add-on services. And these add-on services aren't just there to make money, right? Like they're not doing it like we've seen historically, crappy services just to make money. These add-on services are actually plugging a hole in their clinical, practice that they need, right? So certain cases that are tricky and people are seeing results with these. And then, yeah, they are an add-on service. They're not covered by insurance, and they have good systems in place to be paid cash for that, and it's really helping their practice. And some of these are dry needling, laser. We're going to talk a lot about shockwave therapy today. Dr. Rudnick is really well schooled in that and actually travels the country teaching shockwave. And so we'll dive into that a little bit. It could be supplementation. It could be training, like strength training or physical training, we'll call it. It could be nutrition. It could be all kinds of things that are out there. We kind of really hone in on shockwave in this episode. And, full disclosure, I recently, as I record this introduction about a month ago, purchased a shockwave, and it's just been amazing for our practice our patients are really liking it. It's giving us the ability to treat some things that I was having a hard time with before. And people are willing to pay for it. And it's been a really good cash flow aspect to addition to our practice. And so we do have laser therapy in our practice, and we've had that for about 12 years now. But now we've added shockwave, and we can't do dry needling yet in the state of Florida. Hopefully that changes soon as a chiropractor, unless you are acupuncture certified. So that could be something we look to in the future. But I just want you to start thinking about the potential of add-on services. And Dr. Rudnick does a great job of talking about how he does it without it being too salesy. And I think that's a key that you're going to get out of this episode. Before we dive into that, I just want to make mention, I'm really excited to be speaking again at Jay Greenstein's event. It's going to be your Business Adjustment Summit. So put that in your calendar. That is going to be June 22nd. So June 22nd is going to be the date of that. It's going to be in Washington, D.C., and I'll be speaking at that. We got Jay who's going to speak at that as well. We got Dr. Alan Sokoloff, and we got quite a few others that are going to really bring a lot of information. It's a full day. I did this last year. I learned a ton from my own practice. It's on the East Coast. I was having a conversation with a chiropractor not long ago. That's in our mastermind, and just for some weird reason, the East Coast, the Northeast, the Mid-Atlantic doesn't have a ton of opportunities for you folks, you chiropractors, and here is one that you should be going to each year and checking that out. I'm going to put the link in the show notes. The link's a little bit longer there, but you could also check our closed Facebook group. I've been posting about that. Our Facebook group is Modern Chiropractic Marketing, so check that out. I'll put the link in there. If you put in MCM, that'll give me a little bit of credit on knowing that, I did my part. And we got some folks there that are maybe interested in seeing me speak and some others. So that's MCM when you are at checkout. So do that. You won't regret it. DC's amazing. The group is amazing, and learned a ton last year and looking forward to the same this year. All right, without further ado, here is my interview with Dr. David Rudnick. All right. Welcome to the show, David. I really appreciate your time today. Excited to dive into a fresh topic. We are actually pulling up on our 7 years of this podcast, never missed a week in those 7 years. And somehow we have glossed over this topic of add-on services to a evidence-based chiropractic practice. Before we jump into that, tell us a little bit about yourself personally and professionally, and we'll get into it.
Right. Thanks for having me on, Doc. I really appreciate it, and congrats on 7 years. My name is Dr. David Rudnick. I'm a diplomate, American Academy Board of Sports Physicians. I practice in West Boynton Beach. I've been in practice for about 16 years, owned my own practice for about 14 and a half, 15 years. And I have a fairly exclusive sports medicine, active care, active population based practice. A lot of youth athletes, a lot of active adults, and professional and amateur athletes is what I focus on during the day.
Nice. Yeah, we're not too far away from each other. I actually grew up in that area.
In West
But
Point,
we're
yeah.
yeah, I think we're about what 25, 30 minutes away,
Yeah.
which is good, and gotten to know you over the last handful of years, and it's been cool to see the growth that you've had, which is awesome. But where did you go to chiropractic school? I forget.
I went to National University of Health Science in Chicago. So this was before they had the Florida location. I went to National, graduated from there in 2007.
Mhm.
Opened my practice in 2009. I was an associate for about a year and a half until I came out to West Point.
Perfect. Yeah. And then we were kind of around that same age group. I graduated in '05 from Logan, but yeah, there was no Florida chiropractic schools back when we were matriculating in, so we kind of had to go somewhere else, right?
There was barely a Palmer. Palmer was in its first year when I was about 2 or 3 years in. So,
Yeah. Yeah.
yep.
Yeah. I almost got lucky when I was at Florida State University for undergrad. They were really flirting with that chiropractic school at Florida State, and it would have actually lined up right when I would have graduated. But I don't think I would have stayed because I needed to get out of there to focus on studies.
I understand.
Yeah,
I,
yeah.
I see Pittsburgh actually created its first university-based chiropractic school. So that's exciting.
Yes, it is exciting, and it was something that I was riffing on something. I forget where. I can never remember half the time where I said what, but there's a lot of challenges in chiropractic, right? There's just no doubt about that. But there's a lot of chiropractors doing a lot of great things. And oh, I know what it was. Someone had posted, Chris Chippendale had posted about, and him and I are going to have a podcast about it, but optimism versus cynicism.
Uh-huh.
And we were kind of talking about optimism. And I used the University of Pitt as an example of some chiropractors being overly optimistic and in making something happen, which is pretty cool.
No, it's great. I hope it benefits the profession in the long run. So.
Yeah, I think it will. So we're going to dive into add-on services. Tell us a little bit about what your services are that you add on, and then the listener can really just they can connect the dots if they're not offering Shockwave, but they're offering something else that's not covered by insurance.
Yeah.
They can obviously they can extrapolate out for sure.
Yep. So let me give you a little evolution of how that was based. I opened my practice in 2009, like I said, and I was fairly a largely exclusively insurance-based practice. I took four of the major policies. Back then I was participating with Medicare. I was just trying to do it all because I came from a practice that was mostly insurance-based, somewhat cash, and some PI. So that's what I knew, and that's what I felt like I could develop off of. So that was going well. I was obviously growing and ready to expand a little bit, but I felt like as insurances were getting further and further away of benefiting the patient, I needed to, as my knowledge base, my confidence grew as a physician, I needed to be able to expand on that and help my growth. So an asset to listening to your podcasts and forward thinking things and those mediums, and listening to my colleagues that were doing it and not doing it from a sales point of view, but from a clinical benefit to the patient point of view, that gave me the confidence to expand on that and I think do it well. So when I went and decided to expand my expertise and kind of owning my craft, and that's what led me into being able to do this more confidently. I went and did my CCSP, my chiropractic sports physician certification in 2015, 2016. Then I expanded my office to where I am now. I added about 1,000 to 1,200 square feet. I have a gym in here now. I added a couple extra rooms. I added some equipment. And then I went on and did my diplomate that I finished in 2018. And now I felt like I could start owning my craft a little bit as a sports chiropractor. And when I walk into a room with a patient, people are generally coming to me because somebody had benefit in my office, or an orthopedist knows what we do from a clinical care standpoint and a high level care standpoint. And now I can walk into a room and a patient's not going, I'm just going to hear another sales pitch. They're hearing a very thorough exam. They're hearing my assessment from a different angle, and I'm giving them options. I'm telling them that we can jerk around with your knee for another 7, 8, 9, 10 weeks, but you're already frustrated. You've already come from X, Y, and Z treatments, and you've tried muscle stim, and you tried some adjusting, and you tried general PT before. But what am I able to offer you that's different? Because my adjustment's no different than Dr. Smith's adjustment, right? My ultrasound is no different than that. But what I do know is I have modalities that can now regenerate tissue, right? And I do that with shockwave. We can stimulate stem cells, we can stimulate growth factors, and that inflammation that you're looking for and that you've been searching for reducing, that's not the end all be all. We can reduce inflammation overnight. But how can we regenerate tissue to allow that arm, that leg, that hip tolerate load, so you can go back to playing pickleball, tennis, golf, or you're a college athlete? How can we now make that tissue last longer on a field so you don't have this recurrency? And here's what I can offer you from that modality. Yes, there's a cost to it. Blue Cross doesn't buy into regenerative medicine and curing something, but unfortunately, the pro athlete gets it. They get it 24 hours a day, and we want to treat you the same. So here's our options. We can still jerk around with the other modalities, or here's what we got. How much is it? Oh, it's only $105 a visit. Oh, that's it? That's okay. Let's do that. How many visits do you think I need? Well, if you're not getting benefit by 5 or 6, we're cutting the treatment. We're going to go search for something else. Oh, okay. Well, that's reasonable. Great. I spoke to them honestly as a patient and a person, and sometimes they don't even ask me how much it is. They go, that's great. Let's just do that, because they're looking for that next phase, that next step.
It makes a lot of sense. And I think some of the hurdles you addressed that a lot of chiropractors are thinking to themselves about this is, I don't want to sell. They're also, unfortunately, a lot of people have a little bit of a poverty mindset, and they're putting their financial hangups in the way of the buying decision that the other person wants to make, right? That's a problem. We'll tackle that for sure. I want to first kind of go on a little bit of a soapbox here for chiropractors, is that um, the more and more I talk to chiropractors, there's a lot of chiropractors that are frustrated with the insurance reimbursement, and I get it. And you and I went through hell with it because we're of that experience level where when we were in network with insurances in 09 and 10 and 11, it was paying fairly. It was fair. It wasn't great, but it was fair. And then they really put the hammer to us. And, some decided to go out of network, some stayed in network, but I'm seeing a lot of really good in-network practices who are offering other great ancillary services, be able to get an office visit average dollar amount that is fair. So yeah, maybe there's the one Blue Cross patient that comes in and you get $45 for it, but then the other Blue Cross patient comes in and you get the 45 plus they buy a shock wave or a dry needling or a laser package. And now that visit actually was a fair visit for everybody involved.
My
And then
visit
if you,
average went up 300% by
and
doing
that's the
that,
point.
right?
And I was going to ask you, so I'm glad you mentioned it. It can be done. If you do it right. And then obviously if you are in a state like Florida, and there's a lot of other ones where if you can get a handful of personal injury, it pays really well. Do you get a little bit of personal injury here and there?
No, I've chosen to only take personal injury patients that are current patients of mine.
Yeah.
It allows me to sleep better at night. I know that some of our colleagues will probably drive me into the ground for saying that. But it's just less stressful on my staff. It's less stressful on me. It's not the population I want to focus on. I know I can fix a cuff in
Mhm.
4 to 6 weeks, and it doesn't take 3 years.
Yeah.
So that's just my niche and what I've tried to stay away
Eh,
from. If I know the person and they're a good patient of mine, I'll take a case if they're involved in it. But
Yeah,
otherwise,
no, totally get that. I do know some chiropractors in Florida that great practices that are in network with insurances, but they end up getting 4 or 5 autos a month, and they're doing it the right way. It's still hard. It is hard on your staff, as you mentioned, but that alone has kind of improved their office visit average. So, the moral of this little kind of story part is that you're providing great care to the patient. You're able to provide them an option in your office in network, and you are getting compensated well, and the profit margin is there. So I want people to start looking at that angle when they're doing it. Let's take a break from today's episode and announce our first sponsor. This is going to be Propel Marketing and Design. I've known Darcy Sullivan for years. We've worked hand in hand on my websites. I don't trust anybody else to do the search engine optimization. She does a great job. There's so much to it. A lot of the lingo and the words are beyond my comprehension, but it's just amazing work that she does. And if you're really going to get results with Google, you have to make sure your website is SEO optimized. And I really don't want you doing it yourself as a chiropractor. So you just have to have this type of stuff done. And if you're looking to get more organic online traffic that pulls in new patients, Propel Marketing and Design is currently offering chiropractors who listen to this podcast a free SEO website review. The free review will help you uncover methods that will improve your website and boost your search engine visibility. Head over to propelyourcompany.com/chiropractor and schedule your free SEO website review. You won't regret it. She gets great results. Your website needs this. Your search results need this. Head on over there to propelyourcompany.com/chiropractor to get your free SEO website review. Now let's tackle the sales component, because you mentioned it doesn't have to come across as a sales job, which is great. Um, what what do you think helped you get to the confidence level of just telling the patient what they need and letting them make the choice? What was the kind of
yeah, and that's
process with that?
exactly it. It's letting the person make the choice. It's not telling the person this is what you have to do, and if you don't leave my office with a $4,000 traction package, we're not going to treat you. And that's not the type of office I have. I have a very big toolbox. Sometimes it's difficult to choose what, but let me
Mhm.
give you an example of a gentleman um, who actually came in today. And I had done his ACL rehab for him last fall. Um, Surgeon sent him to us for rehab because he knows that we work with that active population. He wanted good rehab. He didn't want him stuck in a Medicare PT center, doing bands for the rest of his life. He wanted to get back to playing baseball and wooden bat league stuff. And so he sent him here. Anyway, he had a great experience with us in rehab. We never did shockwave on him. It wasn't something that he was interested in back then, but he's had an ACL reconstruction back when he was in college. So we're talking 20 years ago. Okay. And now his right knee is starting to bother him because the graft's starting to loosen up and he's got a little OA in there, but he doesn't want surgery. And it's not really a surgical knee. So he came into me literally today and he goes, my left knee is great. My right knee is starting to give me problems. I know we talked about this a few months ago. And what can we do? And I said, I remember us talking briefly about shockwave and peptides. So we have a nurse, an RN, and a medical director as part of our office who offer that next bridge of regenerative medicine care of peptides, PRP, stem cells, and IV therapy. So I had planted the seed in his head and I said, look, we're not going to heal all your things. Not a surgical patient. So this is the next level of thing. We left it. He calls me. He goes, let's talk about my knee. He goes, what can we do? I go, look, we're going to first get an MRI on your knee. We're going to define what's going on. But he goes, I remember you talked to me about that shockwave and the PRP. And he goes, I've done some research on it. So he's already sold himself, right?
Mhm.
So what do? I talked about literature. What is it going to do? It's going to reduce inflammation. It's going to modulate inflammation. It's going to help repair some of the tissue in there, the part of the tissue that I can repair. And that's ultimately your goal, range of motion and repair. And obviously the exercises he's been doing at home and the other things he's gone through, he's gotten a cortisone in there and some hyaluronic acid. So he's done X, Y, and Z. So now it drove him to asking about something else. He goes, it doesn't matter what it costs. So he's already sold himself on it. He's going to do BPC injections. He's going to do shockwave, and he's going to do rehab. So I talked to him as a clinician. This is how it can benefit your thing. Not it's going to take you 15 visits, and if you do this and if you do that, what is it going to do from a literature standpoint? There's 9,000 studies on shockwave. And I talk about shockwave. It can apply to laser. It can apply to dry needling. You have to know the research. And I don't talk to him from a money standpoint. How is it going to benefit that patient? And the next one's going to come in, it's going to benefit them differently. So how am I going to relate to that person? This guy plays baseball, right? How can he play with his kids, play ball? How can he stay in the wooden bat league? How is it going to relate to them from a goal standpoint, right? Now we're talking about clinical. Goals are very important to us. And we never talk about money. My job is not money. I'm a clinician. How is it going to benefit them? How is it going to provide them relief or not? And how is it not going to be applicable to them? And create that humanistic side, that emotional side to their issue. And that's how I present it. I don't do sales. And if they go, you know what, I'm not really interested, great. Let's stay with the other things that are in network. And you're going to get the person that's a $5 copay with Blue Cross, who's not active, who doesn't want to do this stuff. And I'm never going to mention it to him. Never. There's literature in the waiting room. There's signs out there that say the cost of things. So they see it. And if they want to inquire about it, they do the sales for me, right? I'm not a salesman. I'm a clinician first. So I hope that answers the question.
No, it does. And that's why I had you on for this topic, was because I could have brought someone on that's just, a born salesman and can sell beach at the sand. But I wanted to bring someone on that was a clinician that's doing a really effective job of add-on services in their practice without being salesy. Now, if a person's listening to it and they happen to be really good at sales naturally, then even, you'll
It
do
makes it that
fine, but
much easier.
it
But
does.
most of my patients get turned off from that,
They do.
right? They've either already come from that, they're smarter. Most of our area is upper middle class, right? I mean, the average home price in my area is $850,000. Most people are making $150,000 to $200,000 a year. They're not stupid, right? They're not being sold. They don't need to be sold. They're intelligent people. And if I talk to them at an intelligent level, they're going to respond to that. Some people go, they don't want to hear about stem cell stuff. And you're right. If I see the eye roll of I'm losing them, I don't need to talk about research, right? I'll back it down. But you need to know your population first, right? And if you know your population, then you can speak to them at whatever level of clinical expertise you feel comfortable doing. But I know my patients are smart, and I'm not here to talk to them dumb, right? I don't need to show them an x-ray and draw lines, and I'm not that type of doc.
No, it makes
I'm not
sense.
here to sell. I am here to tell them what they either haven't heard or elaborate on what they have heard from their orthopedists or their other sports docs or their PTs, and provide them something that they've missed out on. That's all.
This is great. And I just think it's important to realize too that you're offering a lot of good things for the patient, and it's you got options and they can make decisions. It's about educating, and you can build a really nice practice around it, even though, because I just hear a lot of chiropractors complain too much about the situation with insurance, and I get that cost of living is expensive. All the things are hard, but you can do this in a way where you are providing great care and you're able to build a cool practice like you have to do it, and then be able to offer more things, right, as you go along. And that's good to see. And it does take profit margin to do that. That doesn't need to be your sole purpose in life, but it is nice to have some meat on the bone to grow a great practice and build a great team like you've done. And I'm sure by increasing your office visit average by 300%, it's helped to do that.
Yeah. And the outcomes are there. The outcomes are right behind it.
Yeah.
Somebody's walking out and going, oh my God, that made my shoulder feel better. Do you think this can work on my husband's Achilles? He's got a really chronic Achilles. And so you talk about, here's a sales thing. They've walked out. They've already scheduled a spouse, a kid, a neighbor. And I didn't even talk to them about their neighbor's issue? Does this also work on, they did it for me. And then
Yeah.
I just talk clinically. Yes, it helps Achilles because of X, Y, and Z.
Yeah.
Done. Right?
And that's the big difference between historically, a lot of chiropractors over the years have done too much of a burn and churn model where if you're trying to do a really hard sales job on, say, a massive package of, a $4,000 package, and you have to do a really hard sales job on that, it can get tricky because you might convince someone instead of compel, you might convince them to make that purchase, but they kind of leave a little bit like, and they're not going out telling their wife or husband, and they're not, telling all their friends, you got to go. So they kind of like, it's just like, let's give it a try. But, like, they're not leaving like that. They're actually leaving compelled. And then they're excited about what they're getting themselves, as far as a treatment. And then obviously they want to tell other people.
Yeah. And you understand from the sports world, they're not here to jerk around for weeks or months on end. They need recovery quickly because something else is coming up. So if you can provide them that quick recovery,
Mhm.
the marketing is easy because I don't have a marketing budget. My marketing budget is getting people better, and they do the marketing for me.
Mhm.
So people go, how much do you apply to marketing? I go, I don't. I spend time. That's it.
Mhm. Yeah.
Time and good
So
standard of care.
yeah, let's get a little bit into the system or whatever. A patient comes in, you've done your exam and all that type of stuff, and you sit down to go over things with them. What does it look like from when you recommend an add-on service to when they go from your room to the front desk? Are they presented with something like, what does that whole little system look like for you
Yeah,
guys?
my office staff is not, they're not clinicians, right? I
Yeah.
have my associates, I have my massage therapist, I have my nurse. We're the clinicians. So the front desk is there to receive phone calls, send out notes, write back emails, right?
Hmm.
Send out records, check out the patient, right? But they're not there to sell anybody on anything.
Hmm.
So I already have a good idea of what that person's coming in for before, so that the front desk does that. They do a really good job triaging that person. If it's, they vet them. If it's not
Hmm.
something that they feel like we can help them with, they won't
Hmm.
schedule them, which automatically increases our efficacy and our outcomes because
Yeah.
that person's coming in and probably going to get helped. So let's give an example. You know what? I had a competitive elite level pickleballer that was in a few weeks ago,
Mhm.
and she had already been to ortho. She has a grade 2 tear of her extensor carpi radialis brevis. She already came in with her imaging. She's had a cortisone injection, actually maybe even two, which, that's a whole other story. But she failed some home PT. Um, Surgeons recommending surgery, doesn't want surgery. What else is there? Okay, so great. So the person that's come in trying X, Y, and Z, and I offer A, B, and C along with X, Y, and Z. So that makes for a little easier conversation. So let's use that as an example. They sit down on the table. We already have our diagnosis. Um, Look, you've tried A, B, and C. My A, B, and C is no different. I have X, Y, and Z. My X, Y, and Z offer consists of extracorporeal shockwave. We have two different types. We have dry needling techniques, and we have extensive rehab. Okay. We also have a little bridge that we can get it outside the box with peptides
Mhm.
and or PRP. The people are very astute. They're familiar with these terms now, which is
Yeah.
also very helpful. Some people are not, but you talk peptides, you talk regenerative medicine, and I think it's been around for just long enough that now you're speaking something that people are a little bit aware of.
Yeah.
So how can those help you? Okay, look, you have a tear. Advil's not going to help your tear, right?
Mhm.
Exercises you've been doing, but we need to regenerate that tissue a little bit more than a wrist extension exercise and a shoulder exercise. How can we do that? Shockwave does this. It regenerates tissue by promoting stem cells, by promoting growth factors, and we can take these fibers and that are separated and start to bring them back together. Does that happen overnight? No, but pain modulation does. You can now grip a coffee cup fairly quickly with that. So now you can work on your strength exercises that are going to be a little bit more effective to you. We're going to stay away from cortisone because that's just going to break tissue down, right? You don't have an inflammatory problem. You have a discrepancy of that tissue. So I give them the paper tear analogy, right? We can work on paper that has little micro slits in it. That's fine. But if we keep writing on that paper that has little razor slits, those razor slits are going to become bigger. We don't need bigger razor slits because now the paper is not viable anymore. I plant peptide seeds if that's something they want to do because they got a big competition coming up, and we can accelerate their healing by 30 to 50%. So now the buy-in from the patient, oh, you have something different than I've been offered before. I don't want surgery. I've done cortisone. I've done PT. I've heated, iced, Advil, beyond. What do you have? So here it is. That's all. I talked to them clinically of how it's going to affect their problem. Never even spoke dollars, right? Some people ask, some people don't. I go, unfortunately, 9,000 papers in the literature, and Blue Cross doesn't believe that it's an effective modality to pay for. So, but I think people are also becoming very smart to insurance is not their friend. It's just something they pay for. If they lose a limb or have a stroke, it's an amazing thing because $1 million hospital bill is going to become a $50,000 hospital bill. So I think in 2024, it's different than 1999, and people are a little bit more astute that insurance is not their friend.
It's a good point. People aren't shocked anymore that their visit, isn't $20 only, like they're not expecting that. They just don't want to break the bank in bad situations, obviously. And so, okay, you've had the great conversation. You educate. Oh, that's one thing I appreciate is like you're doing a great job with them of like communicating and educating, which is so much better than selling. It inherently has a more credibility enhancing aspect to it and it sells itself. Let's take a short break for one of our great sponsors, TrackStat. It is a new type of software plugin for your EHR that combines patient communication, marketing, automation, and statistics with patient and employee tracking. Built by chiropractors for chiropractors, it shows your team what to focus on each day. See patient visit habits, missing information, unpaid bills, insurance collection visit average, and more. Great visibility of data so you can focus on filling your office with your best patients. When you can see what your staff and patients are doing or not doing and take action accordingly, your profits naturally grow. Take TrackStat for a test drive in your office with our free trial. Not a techie, no problem, we can help. To get started on your free trial, visit trackstat.org and watch the demo. That is trackstat.org. So now someone walks him to the front and it's time to pay. Do they just go over what the cost is directly, or are they
Yeah.
giving them options?
Yep. The people that ask me, obviously, I'll tell them what the cost is, right?
Yeah.
We're being humans. We're having a conversation. Um, if they don't, then, hey, you know what? Talk to Karina about packages. It'll save you a little bit of money. But the other thing is we're not doing this 15, 20, 25 visit thing. If they're not improving in a few weeks, just pain wise or range of
Yeah.
motion wise, it's not the modality for them. So I think they appreciate that of we're not drawing something out. If we're not seeing clinical efficacy in 3, 4, 5 weeks for something that's acute to subacute, we're on the wrong track. So, hey, we have a package of 5 or a package of 10. Our 10 packages are reserved for OA, complex issues, maybe multiple areas that we're going to be working
Yep.
on, and they're going to, buy a 10 package so they can save a little bit more money.
Yep.
But I don't think people get shied away from 5, right?
Mhm.
5 is
Yep.
not scary. 5
No.
is 3, 4, 5 weeks, right? 1 to 2 days a week for 3, 4, 5 weeks. People aren't scared with that.
Yep.
Um,
No, it's
so
true.
that's the other thing is presenting it in a very palliative manner so they're not getting scared. But again, we didn't talk to them from a sales perspective. We talked to them as a clinician to a
Yep.
patient. There's no laminated form that I put in front of them and go, pick package A through C.
Yep.
Right?
Mhm.
I don't go to an ortho and they go, pick your surgery package. They go,
Yep.
this is what we're going to do because
Mhm.
this is how it's going to help you. And there is no form. There is no sales thing. I have literally one, and I think I've sent it to you. I have
Yep.
one little thing up front that shows our 3 cash services that we offer.
Hmm.
And then our IV services. But our
Yep.
three cash services, acupuncture, dry needling, shockwave, it's
Hmm.
up there. It's
Yep.
spelled out to the patient with a little
Yep.
thing underneath that says a package of 5 and a package of 10. We're not hiding anything from
Yep.
anybody. This is what it is. There's no hidden fee. There's no anything. It's, if you want these things, here's what they cost. And
Yep.
that's it.
Yep.
Yeah.
No, I like it. It makes it easy. I think where the packages things have struggled in the past for people is that a lot of times it's been tied into just crazy length of period of time, right? 6 months, a year. So that's been tricky for sure for us to overcome that as a profession. And then I think on the other end, sometimes if it's a real large package, um, it's 4, 5, $6,000 and it's a short period of time. It's only 8, 9, 10, 11, 12 visits. Now you got a lot of money per visit. If they're not getting better, after that, they get a little frustrated for spending, 5, 6, $7,000, different things. But
Remember that
this is,
everything is based on clinical efficacy and
yeah,
literature. So some people ask me, where are the studies? They want to see it,
yeah,
right? And everything's
mhm,
based on 1 to 2 days a week for 3 to 6 weeks.
yeah,
That they see it. I'm not making it up. I'm reading the studies and
yeah,
just regurgitating that to a patient. So
mhm,
there's clinical rationale, there's clinical efficacy, there's an algorithm that's built around it. Not, well, I don't know where 6 months to a year comes about when you
yeah,
build a treatment plan for somebody. I,
yeah.
I don't know where
We
it comes
we know,
from.
we know.
God, God bless the people that actually buy into that. But you know what? I probably don't want that patient
Yeah, yeah. No,
either.
I get it.
So,
Hey there, chiropractors. Are you tired of feeling like your dream practice is just out of reach? I know how frustrating it can be trying to balance patient care, paperwork, and billing while striving for that ideal practice you've always envisioned. But guess what? There's a solution that can make your dream a reality. Introducing Genesis Chiropractic Software, the key to unlocking your dream practice. Picture this: no more drowning in paperwork, no more scheduling headaches, and no more billing nightmares. With Genesis, you'll have everything you need to streamline your practice and focus on what truly matters, providing exceptional care to your patients. Imagine a practice where every patient interaction is seamless, every appointment is perfectly scheduled, and every billing process is smooth as silk. That's the power of Genesis. Ready to turn your dream practice into a reality? Schedule your consultation with Genesis today and take the first step towards practice success. Don't let the challenges of running a practice hold you back. With Genesis, your dream practice is within reach. Visit www.genesischiropracticsoftware.com/MCM to get started. Trust me, you won't regret it. Genesis Chiropractic Software, because every practice owner deserves to achieve their dreams.
yeah.
Um, So, part of this conversation was a couple fold. It was brought up a couple times to me, and then selfishly, I got my first shockwave, which I'm excited about. Thank you for helping me make that decision, and it was great to work with Keenest Medical on that. You've been having a big role in the education side. I do want to take a minute to talk about Shockwave on the education side. So tell us a little bit about that. You're traveling with that. You're educating. It's been pretty cool to see. How did you get involved in that, and how are you liking it?
Yep. So back in 2016, I think I was out at ACBSP's American Academy
Mhm.
Board of Sports Physicians, one of their symposiums out in Utah. And I was actually out there to get my CEs for my diplomate, but I was also out there to buy a new laser.
Yeah.
And I sat in a couple of um, seminars there on tendinopathies and some other sports injury things, and they were actually both speaking. They were both orthopedists that were speaking, and one primarily was with the Utah Jazz team orthopedist, and he was talking about Achilles tendinopathy and some other ankle chronic impingement syndromes. And I never heard him talk laser. And previously, laser was huge in the regenerative market and sports medicine. And he kept talking about extracorporeal shockwave, which I was vaguely familiar about, but not to a clinical aspect. And I sat there on my phone and my laptop, and I'm typing in extracorporeal shockwave studies as he's talking. And I walked out of that seminar and I went to the vendors and I started like searching for the shockwave ones.
Mhm.
And I went up to a couple and they were really salesy and I really wasn't too keen on it. And there was several different types of shock waves. Walked up to Keenis's booth and the owner is there. It's a mom and pop company. And he was that humanistic side, right? Like we're talking about how I talk to patients. He was talking to me as a clinician and not as a salesman talking to me. And I grasped onto that very quickly. So anyway, they were very kind. And I said, I'm not really sure. He goes, look, read about the different types of shockwave. You have to know what's best for your practice and we'll talk. So I called him back like a week later. I said, I really want to try this. He goes, look, I'm going to send you a unit. He goes, try it for 5 days. If you don't like it, put it in the packaging, send it back, pay for the shipping. I go, great. So I booked a bunch of patients that week. Well, in the first 5 patients that day, I was already sold that this was a modality that I wanted to incorporate, right? Because the clinical efficacy, I was improving range of motion, reducing pain, and improving inflammation in like a session or two. So that's how I got into using shockwave. I became highly educated in it because I wanted to teach my patients of why it was going to be beneficial. I didn't just plug something in the wall and say, hopefully it works, and then tell my staff this is how you use it. I used it on every patient. I didn't even have my staff do it. I wanted to know that it was working. So long story short, because I was having success with it, I was becoming very educated. And they were seeing that there was a lack of education in the shockwave market. They created a company called the Academy of Shockwave Excellence, which is an education company to educate clinicians that have shockwave. We generally don't even educate on people that don't have the technology, and it's not a company thing. It's not a brand thing. You could have piezo wave, you could have electrohydraulic, you could have electromagnetic, which is what Storts and Keenis sell and what I have. So it was an education thing to provide the clinician with more hands-on training to be able to give that information to the patient. You go, how do you sell it? Here's education. We get clinicians from all over the country and the world to teach the doctors the recent literature and how to provide hands-on technique and training to their staff, to themselves, to provide efficacious treatment. So I've been doing that with them for about 2 years now. It's obviously made me a clinical expert in the modality. And I highly enjoy it because I love educating. And I love educating on a modality that has transformed my practice, that then I get feedback with, it's transformed yours. And I can't wait till you see it's going to do the same thing to your patients. It's amazing.
Yeah, we're excited. And, it's just cool to see how, you come at this from a clinical mindset as an educator as well. Now I don't know if you've ever had it or have overcome it, but you don't have that kind of poverty mindset where you're just like worried about what the patient's going to say about the cost of it. And ultimately it's help you build a really awesome, phenomenal practice. And I want more of that from chiropractors. I just think too many of the ones that are in the clinician slash educator role, they have this negative mindset that, well, you can't be good at business or you can't have this big practice unless you're doing something wrong. And I got into a Facebook back and forth not that long ago about it, where there are some evidence-based chiropractors that are convinced that the only ones doing well in practice are the ones doing pseudoscience and doing things wrong. And I know it's not the case. And
Not the
that was
case.
ultimately why I wanted to bring you on
I'll tell
to
you
talk
another quick
about that.
story. Actually, that gave me more confidence in it. So, my middle brother, he's a pediatrician. Okay,
Okay.
so I had already started my practice. I was probably in practice for about 6, 7 years prior to him opening his. And most pediatricians take insurance. Right? Like
Yeah.
99.9% of them. And he never did. He wanted to create this concierge pediatric model, right? He's right down the road from you, Boca
Nice.
VI Pediatrics. And I go, you are out of your mind. No new parent is going to pay $2,500, $3,000 a year, and then pay for 2 kids. You are crazy. I said, but all the best to you.
Yeah.
You'll be in network with Blue Cross in no time. And he proved me wrong. He's opened 2 practices. He's hired 6 doctors. He's going to be expanding. And he proved me wrong because he took a very big model that you think is fairly insurance based,
Yep.
and he created the concierge model of
Hmm.
high quality care, right?
Yep.
You want to take a picture of your kid's poop at 3 a.m. and text it to them, they're going to answer you back, right?
Hmm. Yep.
Um, and he created this high clinical efficacy and standard of care, and not there's no sales, they're
Yep.
pediatricians, right? I mean, you
Hmm.
can't sell
Hmm.
anybody anything, but he created a high standard of care that didn't involve
Yep.
the insurance model that lowers that. And
Yep.
I took that and I go, look, if you can do it at the pediatric level to a
Hmm.
new parent, then you can do it to a group of people that are not that. So
Yep. That's
that helps
cool.
as
That's
well.
cool. And I
Yeah,
just think a lot of chiropractors need to really consider this because I did make the decision when insurance got bad because I did build my practice in network, which I've mentioned on here a lot. And I decided to go the out of network route once it got bad. And that's been positive. There's always some drawbacks to it. Being in Boca Raton helps. It's very affluent, so it does definitely help. I get a lot of chiropractors in areas where it might not support that. It is a lot harder to build a cash or out of network practice. It can really be a good thing to be in network with insurance. So I'm not one of those that scream from the rooftop, "Don't take insurance." But if you are in network with insurance, I do think you need to look at some of these great services that are going to get your patients better, but also going to help you a little bit to avoid that commoditization trap that the insurance company wants you to be in. And so you get a little more of a well rounded practice with it. And it's obviously something that you've done. So I commend you for that.
it can be done. Seven out of 10 of our patients are insurance based, and 2/3 of those utilize a cash modality in our office.
Yeah. So I mean, I'm glad you
So
brought that stat up because that's so 7 out of 10 are insurance, and then 2/3 of those seven are using some kind of cash paying for an add-on, and then obviously the 3 out of the 10 are already cash services. So you've
correct, right?
kind of, in a sense, escaped the insurance model.
Beyond, yeah, I have
Okay, good.
a very few amount that are
Mhm.
just a copay that you're
Yeah,
getting your $45, right?
cool.
And
Um,
they'll transition themselves to that when they
mhm.
don't see the improvement that they're looking for that we told them they may not experience. So
Awesome. Plus, it just opens you up, and I'll kind of leave it at this. It opens your practice up to a whole other level of conditions that you may not have been able to treat before, which is
absolutely.
in itself a practice builder.
Yep. You see another market, you talk about getting more patients in the office. If you have something that can help another group of patient, that
Yeah.
automatically filters in more people, right?
Mhm.
If you don't treat um, chronic Achilles issues because you don't have
Yeah.
the means to do it,
Mhm.
there's a modality out there to do that.
Yeah. Or you're treating the Achilles and not getting the results, and then you're not getting the referrals.
Yep. I'll tell you what, fracture.
Yeah.
We never treated fracture before, right? And then
Yeah.
no modalities to treat acute fracture. Well,
Hmm.
focus shockwave treats acute fracture because you get a mesenchymal stem cell activation and an osteoblastic activation,
Hmm.
and we can reduce healing time by 30 to 50% in acute
Yeah.
fractures.
Yeah.
So I wasn't seeing fracture patients now, and now I do.
Yeah. No, it's good. And then I think the other thing there's a lot of different companies out there, but a lot of times people look at the costs of different things, lasers and shock waves and this and that, and it can be a big price tag, but many of them have very competitive financing options for you where it just gets worked into your cash flow. You'll end up bringing in more revenue that can easily pay the monthly payment for it. So don't I'm not saying don't pay cash for it. If you have the cash, great, but don't let that be a barrier. Sometimes when you own a business, you do need to take on some business debt to grow, and this could be one of those where it's a pretty fair financing situation for it.
Yes, if you take your profits from that modality, my first shockwave I paid off
Yeah.
in less than 6 months.
Hmm.
I didn't take If there was somebody that paid for it, that went into a pot and that went to payments. I didn't
Yeah.
draw any of that off for business expenses or anything else. That went purely to the payments, and I paid it off in just under 5.5 months.
Yeah.
My
That's
first one. It doesn't have to take me
yeah.
3 years.
That's a very smart business move. It's like because you might have 6 to 12 months before you actually have to pay on it, and then you just pay it off. So
Yeah, right.
cool, awesome. And
Yeah.
then This is recorded before we'll see each other in Nashville for our mastermind. I'm excited to have you join us for our mastermind group this year. It's going to be great. You'll be doing an each one teach one to our group on Shockwave, which will be awesome. I know this episode will come out after that weekend, but looking forward to hanging out with you and learning.
Yep, I'm really excited for that mastermind group. I'm looking forward to meeting everybody in it. Thanks for putting it on.
Of course, man. Well, listen, this was phenomenal. I really appreciate your efforts in, not just, on this podcast today, but what you're doing to educate the profession and obviously what you're doing in your community.
Same with you, Doc. Really appreciate it.
I hope you enjoyed this week's episode. And if you want to make the shift from busy, broke, and broken to time-free and cash confident, or you just want to continue with the exponential growth, check us out at modernchiropracticmarketing.com. Look at the MCM Mastery tab, watch the short video on there, and check out what we are doing now for evidence-informed chiropractors. We are equal parts coaching and marketing done for you. Yes, you shoot some videos, we help you with campaign strategies and ideas and really become a thought leader in your community. You shoot those videos, you send them to us, we produce, edit, and brand them to you. Then we distribute them through all of your channels. We also take them and we turn it into one good blog per month. And every other month, we have Darcy Sullivan producing a robust blog with a topic that you pick from her database to help with your SEO. So we essentially become your content marketing agency to make sure your practice is always having ethical, elegant content marketing to help grow your practice. On the coaching side, we also help you with everything from marketing ideas to business, communications, finances, anything practice growth, and really try to help prevent you from being stuck on that island. And we hold you accountable. We have a great group of doctors that are just doing amazing things, and we look forward to help you out to take that next step in your practice. So again, check us out at modernchiropracticmarketing.com and learn more.